Hi everyone, it's Dr. McQuillan from Berkshire Menopause Clinic. So I've talked you through in a previous video about how you have a smear and why we have a smear. So now you've received your results through the post. And often people find this quite confusing and want to know what it means. So today I'm just going to quickly summarise for you what each of your results mean. Often with this can be a lot of anxiety and worry, and of course if there's anything you're concerned about or you don't understand, then please obviously contact your health professional for more information. And there's lots of good resources which I've put on my Instagram of where you can go for further support. So let's just go through what each of the results. So you've received your results in the post. What does it mean? So the first scenario, you have a normal Human Papilloma Virus, the HPV virus. So that is the initial test that they test for. What does it mean? It's normal. If you have a normal HPV result, the chance of getting any precancerous or cancerous changes are extremely small, and you don't need anything else. It means you can go back to routine normal screening. For those between the age of 25 and 49, that is 3 yearly. For those 50 to 65, that's 5 yearly. That's your normal HPV result. Right, what's another scenario? Inadequate results. So what does that mean? That could mean there hasn't been enough sample taken or not enough of the right sample around the cervix taken. It could mean you may have an infection like thrush or bacterial vaginosis. It's causing the cells to look inflamed and therefore they cannot be read adequately enough. The third scenario could be that you're on your period and again, you can't read the cells properly. So an inadequate sample means that you will be invited to have the test again in approximately 3 months' time. Scenario number 2. Scenario number 3 is that you get a positive human papilloma virus result. And obviously this can ensue a lot of anxiety. So this does not mean you have cancer. It does not even mean that you necessarily have any precancerous changes at all. So if you get a positive HPV, then what they'll do is they will then further test it and where they will look at the cells under the microscope. So if the cells are normal, but your HPV is positive, you'll be invited back to screening in 1 year time. There's a scenario, obviously, if your cells are abnormal. What happens then? So your HPV is positive, you've got abnormal cells under the microscope. So then you will be now invited for a colposcopy. So this is where you'll be invited to go and somebody will look at your cervix under a camera, under a microscope more carefully. So you've now reached the scenario where you're at a colposcopy. So what happens now? So someone looks under the microscope at your cervix and they will see what it looks like. If it looks normal, then you may not even need anything further, no further tests, no biopsies, but you will go back to normal screening. If, however, it looks abnormal, just under the microscope, then that colposcope clinician will take a biopsy. And that biopsy result can take 4 to 6 weeks to come back. And obviously there's a lot of anxiety in that. So what does that mean then? You've got to wait for your biopsy results for 4 to 6 weeks. So if the biopsy comes back normal, you will go back to your routine screening. Again, 3 to 5 yearly. Then there's the scenario if the biopsy comes back abnormal. And again, I want to reiterate, this does not mean you have cervical cancer. The point of all of this screening is to try and get to the point where we catch it before cancer. So your biopsy is abnormal. There are 3 main scenarios that can happen. Something called CIN1, that is mild changes. What that means is often you don't need any treatment and you'll often be invited back for a repeat follow-up with a repeat screening test or a repeat colposcopy, someone looking under the microscope. The second scenario is CIN2. So this is moderate changes. Again, someone will look. You will either be invited for a follow-up colposcopy, so someone to look again, or offered treatment, okay, where they take away the cells. If that happens, then often you will have what we call a test to cure. So a test, another screening test in about 6 months to check that you have been cured and that all the cells have been taken away. And then the third scenario of a biopsy coming back abnormal is what we call CIN3, so high risk, or glandular cells being found. So these are both high risk ones. So here you will definitely be offered treatment. So that is taking away the cells. And again, you'll be offered a test to cure at 6 months, where they will just check with another screening test, or another colposcopy, that all the abnormal cells have been taken away. The absolute final and rare scenario is that at that biopsy, cervical cancer is found. If this happens, again, you'll be offered treatment and any follow-up needed for that. But that is extremely rare. This is why it's so important to turn up for your screening, because you can see I've spent 5 minutes now talking through all the different scenarios before we even get to a point of cervical cancer being found. And that's why it's so important, because there are so many different stages that it can be caught before we get anywhere near cancer. So I really hope that was helpful. Take care.